Welcome to our YouTube channel Medical Subjects Made Easy. Today's topic is pharmacotherapy of drugs in peptic ulcer. 1. What is pharmacotherapy? Pharmacotherapy refers to the use of drugs to treat diseases and medical conditions. 2. What are some commonly used drugs for peptic ulcer? Some commonly used drugs for peptic ulcer include proton pump inhibitors, PPIs, histamine 2 receptor antagonists, H2RAs, antacids, and antibiotics for Helicobacter pylori eradication. 3. How do proton pump inhibitors, PPIs, work? PPIs reduce the production of stomach acid by blocking the enzyme responsible for acid secretion in the stomach lining. 4. What are some examples of PPIs used in peptic ulcer treatment? Examples of PPIs used in peptic ulcer treatment include omeprazole, lansoprazole, and esomeprazole. 5. Can PPIs cause any adverse effects? Yes, PPIs can cause adverse effects such as headache, nausea, diarrhea, and an increased risk of developing certain infections. 6. What are histamine 2 receptor antagonists, H2RAs? H2RAs are drugs that block the action of histamine on specific receptors in the stomach, thus reducing stomach acid production. 7. What are some examples of H2RAs used in peptic ulcer treatment? Examples of H2RAs used in peptic ulcer treatment include ranitidine and famotidine. 8. What are the common adverse effects of H2RAs? Common adverse effects of H2RAs include diarrhea, dizziness, and headache. 9. How do antacids work in peptic ulcer treatment? Antacids neutralize stomach acid and provide relief from heartburn and indigestion. 10. Can antacids cause any adverse effects? Antacids can cause adverse effects such as constipation or diarrhea, depending on the specific formulation. 11. How long should antacids be taken for peptic ulcer treatment? Antacids provide short-term relief and should not be used as the sole treatment for peptic ulcers. 12. Are antibiotics used in peptic ulcer treatment? Why? Yes, antibiotics are used in peptic ulcer treatment to eradicate the presence of Helicobacter pylori bacteria, which can cause or worsen peptic ulcers. 13. What antibiotics are commonly used for Helicobacter pylori eradication? Commonly used antibiotics for Helicobacter pylori eradication include clarithromycin, amoxicillin, and metronidazole. 14. Can antibiotics have adverse effects? Yes, antibiotics can cause adverse effects such as gastrointestinal upset, allergic reactions, and antibiotic resistance. 15. When are prostaglandin analogs used in peptic ulcer treatment? Prostaglandin analogs, such as misoprostol, are used in peptic ulcer treatment when there is a need to protect the stomach lining from damage caused by NSAIDs or to prevent ulcers in individuals taking long-term NSAIDs. 16. What are the adverse effects of prostaglandin analogs? Common adverse effects of prostaglandin analogs include diarrhea, abdominal pain, and uterine contractions. 17. What are the contraindications for using PPIs? Contraindications for using PPIs include hypersensitivity to the drug, severe liver disease, and use with certain medications, such as atazanavir and nalfenavir. 18. Are there any contraindications to using H2RAs? H2RAs should be used with caution in patients with kidney or liver impairments and can interact with certain medications like warfarin. 19. Are antacids contraindicated for anyone? Antacids are generally well tolerated, but they should be used with caution in patients with renal impairment due to the potential risk of electrolyte imbalances. 20. Can antibiotics have any contraindications? Some antibiotics used for H. pylori eradication, such as clarithromycin, may be contraindicated in patients with a history of allergic reactions to macrolide antibiotics. 21. What is the optimal dosage for PPIs in peptic ulcer treatment? The dosage of PPIs varies depending on the specific drug and the severity of the ulcer. It is best to consult a healthcare professional for an appropriate dosage. 22. How should H2RAs be dosed in peptic ulcer treatment? The dosage of H2-ROS is typically once or twice daily, with the strength and frequency determined by the severity of the symptoms. 23. Can the dosage of antacids be adjusted? Antacids are generally available over the counter, and the dosage instructions provided on the packaging should be followed. It is important not to exceed the recommended dose. 24. Should the dosage of antibiotics be adjusted in peptic ulcer treatment? The dosage of antibiotics used for H. pylori eradication is determined based on factors such as the specific antibiotic, the patient's weight, and the presence of any comorbidities. The dosage should be prescribed by a healthcare professional. 25. How long should PPIs be taken for peptic ulcer treatment? The duration of PPI therapy depends on various factors, such as the severity of the ulcer and the presence of H. pylori infection. Typically, treatment may last from several weeks to several months. 26. Is there a specific duration for H2RA therapy in peptic ulcer treatment? The duration of H2RA therapy may vary but is generally shorter than that of PPIs. It is typically prescribed for several weeks to a few months. 27. Are there any specific recommendations for the duration of antacid use? Antacids provide short-term relief of symptoms and should be used as needed and not for an extended period. If symptoms persist, it is advisable to seek medical advice. 28. How long do antibiotics need to be taken for H. pylori eradication? The duration of antibiotic therapy for H. pylori eradication typically lasts for 10 to 14 days, but it may vary depending on the specific antibiotic regimen prescribed. 29. Can PPIs be used during pregnancy? PPIs should be used during pregnancy only if the potential benefits outweigh the potential risks. Pregnant women should consult with their healthcare provider before using PPIs. 30. Are H2-ROS safe for use in lactating mothers? H2-ROS are generally considered safe for use in lactating mothers, as they have minimal amounts excreted in breast milk. However, it is best to consult a healthcare professional for guidance. 31. Can antacids be taken during breastfeeding? Antacids are generally considered safe to take while breastfeeding, as they are not significantly absorbed into the bloodstream. However, it is advisable to consult with a healthcare professional before taking any medications while breastfeeding. 32. Are PPIs suitable for children? PPIs may be prescribed to children for peptic ulcer treatment or other indications under the guidance of a pediatrician. However, the dosage and duration of treatment should be carefully determined based on the child's specific needs. 33. Are there any specific dosage recommendations for H2-ROS in children? Dosage recommendations for H2-ROS in children depend on factors such as the child's age, weight, and the specific condition being treated. Pediatric dosing should be determined by a healthcare professional. 34. Can antacids be given to children? Antacids can be given to children, but the dosage should be determined based on their age, weight, and the specific product being used. It is best to consult with a healthcare professional for appropriate dosing instructions. 35. What are the factors affecting the choice of drug therapy for peptic ulcer? Factors such as the type and severity of the ulcer, presence of H. pylori infection, patient's age, general health, and potential drug interactions are among the factors influencing the choice of drug therapy. 36. Can PPIs and H2-ROS be used together in peptic ulcer treatment? In certain cases, a combination of PPIs and H2-ROS may be prescribed by healthcare professionals to provide relief from symptoms and enhance ulcer healing. 37. Can antacids be used simultaneously with other drugs for peptic ulcer treatment? Antacids can be used simultaneously with other drugs for peptic ulcer treatment, but it is important to consider potential drug interactions. It is advisable to consult a healthcare professional before combining antacids with other medications. If you found this video interesting, please like this video and subscribe to channel.